My name is Courtney Scaggs, and I'm a certified speech and language pathologist both nationally and in Texas, and I have advanced training in certified orofacial myology as well. Speech language pathology is a pretty broad field. We're certified to treat in 9 areas. Here at Dr. Gandhi's office, I do a lot of speech, language, fluency, and feeding, which out of 4 of the 9.
I chose speech language pathology as one of the 4 quadrants of the function first model because we do see that tongue ties or limited tongue mobility does play a big role in the development of speech and language.
There's a huge connection between speech development and what is happening in their mouth. We use our articulators, our tongue, our teeth, our lips to make all of our speech sounds. So if there's any sort of deficit, difficulty, restriction that we're seeing with those articulators, we're going to see an impact on the speech most of the time.
When we see tongue ties, that is one of the biggest symptoms that we see present in our office. We know that doing speech language pathology therapy before and after a procedure can greatly increase the success of the tongue working correctly post-procedure to actually improve speech and language. For our toddler population, that their primary concern is speech delay, we have seen that shortly after the procedure, particularly with the right preparation for the procedure, that within a week or a couple of weeks, the child is speaking more, they're communicating with their not only parents, but society in general. On the older kid population, where we're more concerned with things like lisping or articulation, particularly R's, L's, S's, and T's, we see that post-procedure with continued therapy, that the clarity of the speech gets vastly improved. Also, the child's confidence increases dramatically.
Working with kind of a function-first model and in a collaborative setting has been huge. All of us are just kind of one piece of the puzzle, so if it's just speech therapy and I'm seeing kids over and over and over again for years without progress, then I know, hey, let's step this back, there's something going on. And being able to work in a place where I have those resources at my disposal saves so much time for the families and the kids. We don't have to do a trial and error of, is something going on here? Do we need to, what's going on? We know. We can look, there's a tie, let's get it released so we can get you as far as we can with your speech much faster. Without my dentists, chiropractors, things like that, we don't see the same sort of progress.